The first LDN advocate that I will introduce is Ms. Ann Brasher. She is a 40-plus years Crohn's patient. She is an autism advocate and vice president of the National Autism Association. It was through this connection that she was in the initial informal study with Dr. McCandless and will tell us a bit about her experience with LDN and Crohn's.
Well, there's some brilliant minds here and plenty of information. I am just a person who has lived and dealt with Crohn's for many, many years. I managed to go undiagnosed for 18 years. Because of my age at that time, it was much easier to say that a woman was high-strung and a little nervous. Have a Valium and you'll be better. That's what's wrong with your stomach. Some 18 years later, the official diagnosis of Crohn's came 2 days before surgery for resection. It had done its damage and had to have part of the intestine removed. I stayed pretty stable for 10 years after that. Crohn's did come back almost immediately, within 6 months. And by that time, of course, Remicade had come out. I was one of the first to use it. Had to be in a hospital setting because they were not sure how people would react if there were a reaction to Remicade. I managed to take 5 of those. They didn't do a lot of good. 5th one, I had the allergic reaction, so that meant no more Remicade either. And with the medications not working, I got to the point of being sick and tired of being sick and tired. And if I was going to be this ill, I would, yes, manage with my physician, but I would see what I could do on my own. And around that same time, my youngest grandchild was diagnosed with autism. But as I read about these children and their intestinal problems, I could see myself, I could see myself, I could see myself. But when the paper on LDN came along, and I saw the children, and I saw myself, it was, pardon me, but oh my God. Crohn's, like most autoimmune disorders, does cause joint pain. It does cause fatigue, and fatigue should have a worse name in an autoimmune disorder because it's debilitating. When I got on the LDN, within 2 days, I had no joint pain. Within that first week, I had no more fatigue. And beyond that, my intestinal condition got better and better. So in my 40-plus years, with my trial of every medication known to help Crohn's, with 2 surgeries, and I never made it into remission until last April. And so for the first year in my life, I am in remission, and I think I'll stay on LDN.